Welcome back to Mad-Endo. My name is Morgan, and as you all know, for decades I've lived with the challenges of endometriosis and the struggle to find real solutions. Like so many others, I've searched for relief in countless ways. But one of the most effective treatments I've found is pelvic floor physiotherapy. It has made a huge difference in managing my symptoms, and even now, I continue to go regularly because it truly helps. That's why today I am thrilled to welcome a special guest. We are talking with Kristen Parise, a highly experienced physiotherapist and the founder of Blueberry Therapy in Dundas, Ontario. With over 20 years in the field, Kristen specializes in pelvic health and has dedicated her career to helping people manage chronic pain and improve their well-being and health. She's here to share expertise on how pelvic floor therapy can benefit those with endometriosis and chronic pelvic pain. So let's dive in. Hello, Kristen. How are you?
Thank you, Morgan, so much for having me. I'm very excited to be here. And I love when I hear like highly trained. It just makes me sound like I've been around a long time.
I'm really happy to have you on the show, and I just want to get into some questions that can help some of the women out there. So,
Yeah.
could you
Yeah, I was
go
gonna
ahead?
say like this for me is so exciting because in working as a pelvic floor physiotherapist, this client population, people that have endometriosis need so much help, and we see such amazing things. So I am very happy to be here too.
Good. Can you tell us about your business a little bit and what inspired you to start it?
Absolutely. Yeah, it's a bit of a journey. Are you ready for it?
Yes,
Um,
absolutely.
so I had been a physio for many years, like almost 20 years when I started the business, actually. I had done lots of different work as in pediatrics, in home care, for a national home care organization, in an administrative position. And I decided, I was getting a bit burnt out by a few things, and I decided I need to go right back to clinical physio. But I really was not a big fan of treating necks and backs and shoulders of weekend warriors. But,
Yeah.
there's some physios that do it exceptionally well, but that's not me. I liked having extra time with clients. I like to be able to address things that are really necessary for clients' everyday life. And I decided as soon as I left that National Home Care Organization that I wanted to do something in pelvic health. So I went back and I did a couple of courses, and that's where I met Megan Solomons, who I know you know well, at
Yeah.
Blueberry Therapy. And it was like the lights went on. It was like
Mm.
everything that I had done up until that point, I realized was helping me in this area. I loved the content. I loved being able to spend time with clients. It's a sensitive issue. Lots of times we're
Yeah.
talking about peeing and pooping and pain and sex.
Yeah.
And being able to allow people to have those conversations and me have some answers for them. I just loved everything about it. And I've been like an absolute student of the game ever since then. And so I actually started and I was just renting a room in the current location of Blueberry Therapy.
Oh,
And within about 6 months, the owner, who was a wonderful massage therapist, and she still practices as a massage therapist, said to me, Kristen, it's very clear that you like the business part of it. And I really don't. I just want to be a clinician. So within 6 months, I bought the business from her.
oh, wow.
And I rebranded as Blueberry Therapy. And that Blueberry Therapy is that cue that we often give, especially for people who identify as women, is that you pull that blueberry up and in, which is one of the reasons. Yeah. Did you know that, Morgan?
All that. I was gonna ask. Okay. I get it now.
One thing that kind of made people think and it made them laugh. And there's a lot of like pelvic health, this, pelvic support, that, which is very clinical. And
Mm.
I wanted to right off the hop with people, make them kind of laugh, make them kind of think, right?
Yeah.
So I started the business, and right from the conception of the business, there were a couple massage therapists and a couple of physios. But I really wanted to be really wraparound services because
Mm.
when people are in chronic pain, We know that the emotional component is so high, and so I wanted to have psychotherapists. I knew that people were bringing in babies potentially, and I wanted to have lactation consultants. I wanted the pediatric side. So the whole vision was always to have kind of one-stop shop, particularly for women, but we have a lot of men that come through the office as well, so that they could have all the services in one place. And that it stayed really true to that pelvic health and what supports your pelvic health. So yeah, that's it is a bit rambly, but that's the main reason that I started the business.
No, I really like that. As you know, I am a client of yours. I really love coming to Blueberry Therapy. It's a very relaxing and calm environment, and everyone's very welcoming and lovely. And Kelty, your receptionist, is the best. But you
You?
also you also suggested or said men, and I know that we're going to talk about endometriosis in women, but I'd love to touch on men because I think a lot of men don't think about pelvic floor therapy and how it can help them. So just can we touch on that just briefly on from the male side of things?
Yeah, 100%. I mean, one of the things I say whenever I go give a talk is that everybody has a pelvic floor. Whether you're an infant, a toddler, through your teenage years, across the lifespan, we all have that pelvic floor, and all the genders have a pelvic floor. So we like if you just think about peeing and pooping and pain and sex, it can impact anybody.
Mm,
So we see definitely gentlemen who have um, testicular pain, rectal pain, issues with erectile function. Maybe they have premature ejaculation or can't sustain an erection at all.
mhm.
And all of those things might be because of the pelvic floor. Not always is it 100% pelvic floor, certainly, but pelvic floor muscle and the way it contracts and the way it releases can really impact those things. And then the other things as well. We see a lot of people after they've had a radical prostatectomy. So if somebody has prostate surgery,
Oh, wow.
they remove the prostate, and most of those people after surgery have a fair bit of urinary incontinence. So they're
Okay.
leaking pee all over the place, and that's not fun for anybody.
No.
Or people that have chronic constipation, people that have low back pain, and that really is not gender specific. It could be
Mhm.
anyone. And I mean, if we're thinking about what all we do, as I mentioned, I mean, we see kids with chronic constipation, bedwetting, fecal
Mhm.
incontinence, giggle incontinence. I mean, anything that impacts bowels and bladders and pelvis, then pelvic floor physio is what you need.
Yeah, definitely. And how do you see your business growing? Because you talk about it being a one-stop shop, and I know already you do have therapists and you even have yoga and natural. Is it naturopath that you have there? Naturopathic. What else do you see? How do you see your business growing with that in mind?
Yeah, that's a great question. I'm always thinking like what comes next.
Yeah.
And so I mean, in the fall, if you've ever been through the business, we opened up a one area that can accommodate larger groups. And we are doing different yogas, mom and baby yoga, prenatal yoga, mindfulness yoga, perimenopause and yoga,
Mhm.
as well as some core strengthening programs. And it is a space that the community can use too. And I do want it to be so we have Gather Montessori who's coming in and doing Montessori programs for both kids and older adults. We
Mhm.
have the mommy connections that are coming in. And so, I want that space to integrate into the community and make it an
Mhm.
easy space to come into, so that community piece is so important to the business as a whole. I mean, when we first started, every summer I would run a community party in our parking lot, and largely to say thank you to the community, thank you to the Dundas Parents Network on Facebook and the Ancaster Moms
Yeah.
group. They were really instrumental in helping the business grow.
Mm.
So I am so thankful for the community that we're in. At the same time, some of the things that I'm doing now are growing the business beyond our geographic location. So I myself started a podcast, the Whole Shebang podcast, and that one is intentionally trying to demystify some of the pelvic floor information. I'm launching a women's sexual health conference this year on May 30th. And again, just trying to uh, get some of that education out so that everybody has the information and then doesn't feel so hard to get the information or potentially as a person to get the treatment that you need. And I think integrating different virtual type programs that make it easier for people to access services. So I'm looking at some models now where somebody, maybe they come into the business once physically, maybe they don't, but
Mm.
they have a pelvic health assessment. Then they are followed by either a pelvic physio or an exercise professional at home so that they're doing their program and then they have different touch points. So, I'm thinking about how do we spread our wings a little bit. And virtual is a really nice opportunity that we saw during COVID expand
Yes.
that has lots of opportunities for businesses. Yeah.
That's really exciting. It's nice to hear how passionate you are and how like excited you are to evolve things. And that's really wonderful because I can definitely say, from my experience with endometriosis, I didn't even know about pelvic floor therapy until a few years ago, when my specialist said, "Oh, you've got to do this." And then next thing you know, I found you guys, and it's really been a life changer. I still go now, even after a hysterectomy, because I find it's very, very helpful.
Yeah.
Yeah.
Yeah, and you're not alone, Morgan. I mean, even without any type of diagnosis, I mean, part of the other reason that I knew pelvic floor existed is I had a child 20 years ago, ran on a treadmill and leaked all over myself, thinking I was like sweating like crazy and realized that's not sweat. Ended up with a pelvic floor physio, right? And so
Yeah.
I was a physio and didn't even know it existed.
Wow. Yeah.
The rise in knowledge about pelvic floor physio has really increased, but it still has a long way to go
Hmm.
among the general public, but
Mm.
also in the medical profession. So one of the other things I didn't mention is I am connected with the McMaster uh, Medical School and their family medicine resident training program. And I'm doing workshops every other month and having residents come out to the business. So they have at least some insight into what a pelvic floor physio does. And hopefully then I plant the seed. So when they land in, London, Ontario, and now they're going to reach out to their pelvic floor physios there. So I think a lot of awareness and a lot of education will be helpful both for medical professionals, but at the end of the day, for people.
Yes, I 100% agree with that. That's amazing that you're doing that work. On that note, talking about that, what do you wish more people understood about your field of work?
I wish they knew it existed.
Yeah.
Just start there. And then I think a lot of people think pelvic floor physio is for people who have had a vaginal birth, so that it's very narrow slice. And we're always trying to make the case that, as I said before, we all have pelvic floors, whether you've had children or not, whether you are like any gender, if you're going through a gender surgery, we would see you.
Mhm.
If you're a child with constipation, if you're a woman who's had a baby, but it was a C-section, like there's still lots of things we can do. And I think, the push would be almost, you do those well baby checkups or well adult checkups. I would love to see everybody at some point in their life come in and see a pelvic floor physiotherapist, understand how is their pelvic floor working? Is that contributing to some of their back pain? Is it contributing some of their urinary urgency? And so that they can progress and age gracefully, because we know there's lots of things that can be prevented if we just have that knowledge. And so I think those are the things I think about when you ask me that kind of question.
Yeah, definitely. I would agree with you. I know that I was surprised in when I started doing the pelvic floor therapy how some things changed. I was really shocked by it, and then that's what really clicked for me to realize how important it is. Like for many years, I couldn't even like you go to yoga and they're like sit in a comfortable seated cross-legged position. I was like, this is the most uncomfortable position. It's because my pelvic floor was so tight. Now I can sit cross-legged. I'm like, yes, but it was many years and I couldn't figure it out. But it was pelvic floor therapy that allowed me to do yoga in that comfortable position. Sorry, these come up. I don't know why these come up. I haven't figured out how to stop it. So they'll come up randomly, little celebrations.
Say, and again, even for me, I went to the Ontario Physio Association conference one time. And again, before I was a pelvic floor physio and heard a pelvic floor physio speak. And she talked about, the number on average, people go to the bathroom to pee 6 to 8 times a day. And at the time, I was peeing way more than that.
Mhm.
Um, and I just started kind of monitoring and checking and see why am I going to the bathroom? Am I going to the bathroom just in case, just before you leave to hop in the car, or just before you finish a meeting or start a meeting or what have you? And I think I think people accept a lot of things as absolutely normal that are not normal. And if you've seen a pelvic floor physio, you can ask all those things like, how often should I be going to the bathroom? How often should I be having a bowel movement?
Yeah.
Should sex ever hurt? I mean, all of these things that we hear every single day where people will say, you know, it happens. I mean, it's just always happened like that for me. And
Yeah.
and and it's not actually normal. So
Yeah.
it's a lot of myth busting and it's a lot of education, which I actually really enjoyed that piece of it too.
Yeah. Yeah, I can definitely agree with that. I think a lot of us do sort of accept things that are as normal that don't realize maybe that's not so normal. I just wanted to ask, like, have you noticed any shifts in how women's health, particularly pelvic health, is being addressed in healthcare? Um, I feel like my experience as a client or as a patient, definitely for me, it was never anything that was suggested or asked of me to do in any kind of way. It was if there was any kind of, alternative or supportive therapy, it was something that I found on my own. But it was only until recently that I've started to see it kind of become something that's actually even coming into our own Canadian healthcare system. So I guess I've answered my question, but what do you how do have you seen it change since being in the field?
Yeah, I would say I see it exactly as you do. Over the last 8 to 10 years, I would say that we see way more referrals from physicians or other healthcare professionals coming into the business. So when we first started the business, and that may not be 100% the healthcare system, that may be age of business as well. But at the
Mm,
beginning, I thought as a business owner, I got to speak to every doc in the area so that they'll refer to Blueberry.
mm,
Um, and then when I would look at the reports, it was like 95% of people came because of word of mouth and friends, and 5% from physician referrals.
mm.
Over the lifespan of the business, we're almost 50-50 now.
Oh,
So
wow.
so some of that's age of business and development of reputation and connections and all of that, but some of that is what's changed within the healthcare system. We and we are one of the other reasons I love being a pelvic floor physiotherapist is the research to support what we do is profound. We don't have this level of research in other parts of physio
Oh,
to this extent. So there's really large systematic reviews that show that if people have pelvic floor physio when they have stress urinary incontinence, that it can 80% of people are cured or helped by pelvic floor physio. Like that
wow.
cure word, we just don't get in other.
No.
Um, when we look at things like seeing people in pregnancy, we know that pelvic floor physio can help reduce the grade 3 and grade 4 tears that occur,
Oh,
which can be
wow.
quite life altering for people. And then it just goes on and on. So it is exciting to see the research support what we do,
Hmm.
and in turn have people and other healthcare professionals see it, refer to it. And I mean, we have many docs that come through the office that are our clients too, right? So
Oh,
there's a belief system that has improved over the last 8 years for sure.
that's so positive. That makes me very excited. That's great. If I were to come into your office and say my first time and say, "Hey, I'm getting some pelvic floor therapy," what's going to happen to like where do we what's the what's a typical yeah.
Yeah, so I always say that that first visit is a bit of a choose your own adventure because there are lots of ways. Yes, there are lots of ways that we can assess the pelvic floor. But if I just take gold standard, and so the reason that we are pelvic floor physios and what differentiates us from a general physio. So we all have the same level of university education. And then we have to take additional courses and be rostered with the College of Physiotherapists to do pelvic floor physio, which is typically internal vaginal or internal rectal assessments. And the reason that we do that is the research is really, really good to show that when we do that, it is providing the person with really good feedback about how the pelvic floor is working or not. Because when we do things like tell you how to contract your pelvic floor and give you an information sheet about how to contract your pelvic floor, we know something like 70% of people don't do it right. It's just
Mhm.
internal muscle. It's hard to kind of visualize, figure out where. But if we actually put our fingers in the vaginal canal or rectal opening, then we can cue people on how to contract the pelvic floor. We can also ascertain whether, is the front working but not the back? Is
Mhm.
the right working but not the left? Is this muscle holding all kinds of tension? Or is there a ton of laxity and it's really weak? All of those things, the easiest way to do is through that internal assessment. So gold standard, you come into my office, we have a good conversation about, what are the things that are bothersome for you? Are you in pain? Are you leaking pee or poop? Are you having pain with intercourse? Are you finding that you have no core stability? All of these kind of things might come up. Or do you have constipation? And
Mhm.
then we narrow it down to the things that are most important to you. With your consent, we do that internal vaginal or rectal assessment. Then we also may look at external muscles around the hips, around the low abdominals, because that all contributes to how the core is working. And then we meet back and we develop a plan that makes the most sense for you. And this isn't typically where you're coming in 2, 3 times a week or anything like that. I'm seeing you, we're developing a plan, we're expecting that you're going to do some homework at home, probably. And then you're going to meet back and we're going to see, are we addressing those things that are your concerns or that you want to prevent, which we are very happy to see people for. If somebody says, though, Morgan, I do not want that internal assessment, that is 100% okay. We can assess it externally. I mean, that pelvic floor runs from the pubic bone at the front to the tailbone at the back and to your sit bones. So
Mhm.
even externally, we're going to kind of be up and in underneath those sit bones. We can feel if the pelvic floor is working. I use sometimes a diagnostic ultrasound. So I'll put that on your low abdominals. And in that way, I can look on a app on my phone to see what's happening with the bladder, what's
Oh,
happening with the
wow.
pelvic floor. Yeah, that's pretty fun. I got that many years ago, mostly because of my pediatric clients, because we don't do internals on kids like 97% of the time we don't. The
Mhm.
one, but it's really hard sometimes for kids to communicate what's happening and for us to see when we give them cues if the pelvic floor works. So we can
Mm.
do that. We can see, as you move, how your core is stabilizing, and is an indirect measure of your pelvic floor. So there's the gold standard, and then there are lots of different options within. And I think the other thing, this is one question we get all the time from our female clients, is they'll call and say, I had an appointment tomorrow and my period came early. Can I come in? And we always say, there's a ton of other things that we can do. And at the same time, it doesn't bother us at all, right? So we leave it up to the client, of course. If you feel comfortable, we may still do that. And sometimes doing an assessment or doing a treatment while someone's menstruating is when they have peak symptoms anyway. And sometimes it gives us some really good information. And other times
Mhm.
people say, not today. And we do a bunch of other things. So we are that general physio has these additional skills and we can function, more holistically if we need to.
Yeah, Megan made me laugh actually because I was meant to come in with her and I was like, I was afraid I was going to have an accident. She was like, oh, don't even worry about it. You could come in and have an accident, wouldn't even be a problem. I was like, oh, okay.
It's true. Most of the pelvic physios that and will meet are pretty laid back because like I mean
Yeah,
we get into some pretty touchy and deep stuff and we have some stuff leaking and it's all good.
it's just all part of it, right? And it's just all like on the road to getting healthier. So, can we talk a little bit more about pelvic floor therapy and how it can directly relate to women with endometriosis? Like, how would it affect, how would the pelvic floor therapy react to someone with, with endo? And then how would you treat them and how could they benefit? Like, if I were to say to my friend, oh, you have endometriosis, you're really going to benefit from this. Can you explain that to me a little bit? Or, I'm sorry, I've asked like 4 questions there, but
Okay, that's okay. If we start with with the pelvic floor, what happens with the pelvic floor with endometriosis?
Mhm.
Largely what we see with endometriosis is the pelvic floor holds way too much tension. So I always say to my clients, if you think about a hammock, that's how the pelvic floor should be. It's this nice, soft hammock that, the organs kind of bob along in it. They feel super comfy.
Yeah.
And then when it contracts, which contraction is important for stopping pee, stopping poop, for orgasms, like we need to stabilize our core. So that contraction makes the hammock go from hammock to jellyfish or that blueberry up in it. And then from that jellyfish, it goes back to the hammock. And
Hmm.
when people hold too much tension, I often say to my clients, it feels like a steel beam in there, right? And so when you have a muscle with way too much tension, it contributes lots of times to pain.
Hmm.
In endometriosis clients to urinary urgency, sometimes constipation, or sometimes pain with bowel movements might happen, pain with intercourse. So
Hmm.
there's a bunch of things that tense pelvic floor can contribute to. And it's hard sometimes to tell, like, is it the pelvic floor that is causing things, or is it the endometriosis and the inflammation and all of that is causing the pelvic floor to have tension? I mean, it's definitely a chicken and the egg situation sometimes.
Yeah.
But but the other piece is I have lots of people that have endometriosis that have incontinence. So they leak a
Mhm.
little bit and and as soon as people leak, they assume that the pelvic floor has to be weak.
Yeah.
If you have a weak pelvic floor, then people say you got to do your Kegel. So you're tensing and tensing and tensing. And so, I'm here to say that you can leak with weakness and you can leak with tension. And
Yeah.
it's like the muscle is this really taut elastic band. And when you need it so that you don't leak with a sneeze or something, it has so much tension, it doesn't kick in time. And so I am doing a lot of conversations. I'm having a lot of conversations with my clients about how do we get some relaxation in the pelvic floor to start? What does that look like? Is it you doing lovely yoga poses, child's pose, cat cow, um, deep squat? So is it simply doing some big belly breathing? And that belly breathing is so good, we know, for both muscular movement. It's good to down regulate the nervous system. So we might be doing some of that. We might be doing some mindfulness, some meditation, just because when people are in pain for a really long period of time, their nervous system gets upregulated, and it's hard then to bring it back down. So those are the simplest things we might start with in terms of treatment. And then we might move on to other things. So we might move on to a client doing their own self massage in the vaginal canal to try and lengthen the tissue, to try and lengthen the muscles, the connective tissue, all of that kind of stuff. And sometimes that is really important because when you're in pain and when an area of your body doesn't feel very good, lots of times you shy away from it, right? You don't want to
Yeah.
touch, you don't want anybody to go near it. And so getting to the stage where you can do a little bit of that self massage means that you are touching yourself. You
Hmm.
are feeling as the tissue tense, you're feeling it release, and it helps you to gain trust in the fact that it can release again.
Yeah.
Beyond that, we might be finding that as soon as we get rid of that tension, that there actually is some underlying weakness, and we might be doing some strengthening. But we also might be doing some things like talking about if you're having pain with sex, is it all intimacy that you're having pain with?
Hmm.
Is it strictly intercourse or penetration? Are there ways that we can find pleasure in other ways? Like, is clitoral stimulation okay? Is oral stimulation okay? I'm counseling my clients all the time to when they get to this point, when they feel that they can,
Hmm.
to find pleasure in ways that they can, because we want to move from thinking very negatively about the pelvis and vulva and vagina and everything to feeling much better about it, and not just feeling like we're not in pain, but that we can actually have pleasure.
Yeah.
And I found that, when I first started, I would say, what is your goal? I don't want any more pain, which makes sense, right? If you've
Yeah.
been in pain a long time.
Yeah.
This is an area of our body for many people where you feel pleasure. So I would say that to my clients, okay, that's a good step, but let's get to the point where you can have pleasure again in whatever way that makes sense for you, whether you have a partner or not. So that's a long answer to anything in there you want to dive into.
No, I like that we're talking a little bit about the sex because that was definitely something for me that's been a problem and I'm still working through it. And, I've had a hysterectomy. I still got one ovary there. I guess my mind's going in two places. First of all, I've got one ovary on the left, and that area still gives me tension. So it's funny when I see Megan, the right's feeling good and the left's always a little tense. But I wanted to ask a couple of questions about that. My mind's going in a couple of different directions, but we were talking about sex. And I can say that even after having the hysterectomy and starting to feel pleasure with sex again, I'm at a stage where I'm still like, there's this hesitation a little bit that I'm, working through where we'll start to be intimate and I'll like almost tense up because still afraid it's going to hurt. And then I
Mhm,
kind of relax a bit when I realize, okay, it's not hurting. That's good. Because, there's definitely been times where it was quite painful. There's definitely been times where I've had sex and then all of a sudden I've been just like, he's hit a point because I did have extremely tight pelvic floor, and I also did have like the plaque endometriosis in areas of the tendons where it caused pain during sex. And there was points where he would hit and I would just be like, ah, like, and it was very like sex was really difficult for a long time. And so even though now it's feeling better, there's still this sort of like I'm working through this sort of the leftover reactions from that. And it is getting better. We are feeling pleasure, but yeah, it's good to talk about that because there still is a process even when you are free from that pain to sort of, I don't want to say retrain yourself, but there is a point about, okay, it's great. I'm not feeling pain again because that was my goal. Like, let's just not feel pain, right? And now I am into getting into that mode of let's find the pleasure, and we are getting there. I am feeling it, so it's nice to get there, but there's still a few more steps to get through, so I don't have that sort of almost like, is it going to hurt? Okay, no, it's okay, you know. So
yeah.
yeah.
I always say to my clients that, when it comes to pain, especially pain with the pelvis, whether it be sexual or otherwise, if we as pelvic floor physios just address the muscles, that we've only done half the job. Because we know that if you're in pain longer than 12 weeks, that there's actually a neurochemical and neurobiological change that happens in the brain.
Oh, what?
Yes.
Wow.
So we can lengthen the muscles, we can work on feeling pleasure and all of those things, but the breathing, the mindfulness, the meditation, the taking time to enjoy things. So I often, as homework, tell my clients that I want you to find joy in some way every single day. So,
Hmm.
and I want you to be present as you're feeling it. So that might be talking to a friend on the phone who makes you laugh. You're howling on the phone. It might be following a silly Instagram that's a joke of the day. It might be being out in nature and walking and just feeling that real joy of being there. And so the reason we do these things is because we want to reset that neurochemistry and neurobiology of the brain. And so in resetting the brain, we reset its vigilance to the pelvis, because that's what's happened, right?
Interesting.
What, yeah, after that 12 weeks, we flip from acute to persistent pain. And there's a actual biological process that changes in the brain. So
Wow.
so yeah, and that is one of the coolest things I think about what we as pelvic physios do, because we see a lot of people who've been in pain a really long time, like people that will say, they're in their 40s, and you say, when did this start? And they'll say, about the time when I started having menstruating. And I'm thinking, "Ooh, that's a long time, right?" But it makes sense, because lots of people who have endometriosis in their 40s, it started when
Mm.
they first started menstruating.
Yeah.
And so your body every month gets used to feeling pain. And
Mhm.
then, if you've had intercourse many times where it's painful, your body gets used to like feeling that pain. And when we're doing that internal assessment, we're often assessing, how much pain is that? Does it feel burny? Does it feel stingy? How does it feel? One of the things that we see as the muscles settle down, as the brain settles down, is the same amount of input. So the same amount of pressure elicits less or no pain.
Oh,
And so that's like a bit of a switch, but I'll say that to clients, like I'll push on their arm and I'll say, this is the amount of pressure I'm using. Is that painful on your arm? And they'll say, yes or no. Most of the time is no.
mhm.
Then I'll use that same pressure internally, and they'll say, "Ooh, that is way more. That is painful." So
Mm.
so we're trying to level set almost. We're trying to get that brain to be less vigilant to the area, because it's been in pain for so long that we've had those biological changes in the brain.
That's really, really interesting. I didn't realize that. So you're saying in order to sort of reverse that in a sense or calm that brain reaction in the sense we need to be doing meditations and being in the moment. So if I'm somebody that's, let's say, I'm having intercourse and I've just had like some painful sex. Should I be doing these practices in the moment of pain, or should I be doing them on like when I already am calm, or like what's a good time to be doing these sort of things to help that neurobiological response?
We do a lot of them in advance. Like we do them like your physio
Oh,
would give
okay.
you your pelvic floor lengthening exercises and meditation exercises, right? We
Okay.
do them at the same time, because we want to address both the muscle and the brain and the nervous system, and down regulate the nervous system. At the same time, a lot of us coach our clients, when they're trying to get back to intercourse, to do some nice deep breathing, to connect with their
Hmm.
muscles, to try and stay present in the room. So bits of them can be used in the actual moment, but a lot of them is the practice
Okay.
before. Does
Okay.
that make sense?
Yes. Okay. No, that's
Yeah.
good. It's good to note. I can definitely understand when you're talking about women in their 40s and, having been pain for so long. I didn't realize I was in so much pain. It got to some point where they're like, how much pain? I'm like, I'm not. It wasn't till like I really started getting healthy and had the hysterectomy that I was like, oh, I was in pain. Like, like, I just like, you know what I mean? You get so used to it that you're like, no, that's not painful. And then you're like, once you get healthy, you realize, no, that was. So yeah.
Honestly, my endometriosis clients are like warriors. Like they're in, and you're right. They're like you. They don't even realize how much pain that they're in. But it can be an incredible amount of pain that they are just managing every single month. And to get out of that is just so, it just allows you to live again, right?
Thank you for joining me today. Remember to come back next week for the second part of the interview with Kristen. Now, stay strong and remember, you are not alone. See you next time.